Hello guys, how are you? I think you will be fine and enjoying a good health. Today's my topic is on hepatitis C. Hepatitis C is a viral infection that causes liver inflammation and damage. Inflammation is swelling that occurs when tissues of the body become injured or infected. Inflammation can damage organs. Viruses invade normal cells in your body. Many viruses cause infection that can be spread from person to person, and the hepatitis C virus is spread through contact with an infected person's blood. Hepatitis C can cause an acute or chronic infection. Although no vaccine for hepatitis C is available, you can take steps to protect yourself from hepatitis C. If you have hepatitis C, talk with your doctor about treatment. Medicine can cure most cases of hepatitis C. About acute hepatitis, it is a short-term infection. Symptoms can last up to 6 months. Sometimes your body is able to fight off the infection and the virus goes away. When we are talking about the chronic hepatitis C, which is a long-lasting infection, and chronic hepatitis C occurs when your body is not able to fight off the virus. About 75 to 85% of people with acute hepatitis C will develop chronic hepatitis C. Early diagnosis and treatment of chronic hepatitis C can prevent liver damage. Without treatment, chronic hepatitis C can cause chronic liver disease, cirrhosis, liver failure, and liver cancer. In the United States, hepatitis C is the most common chronic viral infection found in blood and is spread through contact with blood. Researchers estimate that about 2.7 million to 3.9 million people in the United States have chronic hepatitis C. Many people who have hepatitis C don't have symptoms and do not have this infection. Since 2006, the number of new hepatitis C infections has been rising, especially among people younger than age 30 who inject heroin or misuse prescription opioids and inject them. New screening efforts and more effective hepatitis C treatments are helping doctors identify and cure more people with the disease. With more screening and treatment, hepatitis C may become less common in the future. Researchers estimate that hepatitis C would be a rare disease in the United States by 2036. People more likely to get hepatitis C are those who have injected drugs, had a blood transfusion, or organ transplant before July 1992, have hemophilia and received clotting factors before 1987, have been on kidney dialysis, have been in contact with blood or infected needles at work, have had tattoos or body piercings, have worked or lived in a prison, were born to a mother with hepatitis B, or are infected with HIV, have had more than one sex partner in the last 6 months, or have a history of sexually transmitted diseases, or are a man who have or had a sex with men. In the United States, injecting drug is the most common way that people get hepatitis C. Doctors usually recommend one-time screening of all adults aged 18 to 79 for hepatitis C. Screening is getting testing for disease in people who have no symptoms. Doctors use blood tests to screen for hepatitis C. Many people who have hepatitis C don't have symptoms and don't know that they have hepatitis C. Screening tests can help doctors diagnose and treat hepatitis C before it causes serious health problems. Without treatment, hepatitis C may lead to cirrhosis, liver failure, and liver cancer. Early diagnosis and treatment of hepatitis C can help prevent these complications. Cirrhosis is a condition in which the liver slowly breaks down and is unable to function normally. Scar tissue replaces healthy liver tissue and partially blocks the flow of blood through the liver. In the early stages of cirrhosis, the liver continues to function. However, as cirrhosis gets worse, the liver begins to fail. Then comes the liver failure, also called the end-stage liver disease. Liver failure progresses over months, years, or even decades. With end-stage liver disease, the liver can no longer perform important functions or replace damaged cells. Then comes the liver cancer. Having chronic hepatitis C increases your chances of developing liver cancer. If chronic hepatitis C causes severe liver damage or cirrhosis before you receive hepatitis C treatment, you will continue to have an increased chance of liver cancer even after treatment. Your doctor may suggest blood test and an ultrasound or another type of imaging test to check for liver cancer. Finding cancer at an early stage improves the chances of curing the cancer. Most people infected with hepatitis C have no symptoms. Some people with an acute hepatitis C infection may have symptoms within 1 to 3 months after they are exposed to the virus. These symptoms may include dark yellow urine, feeling tired, fever, gray or clay colored stool, joint pain, loss of appetite, nausea, pain in your abdomen, vomiting, yellowish eyes and skin called jaundice. And if you have chronic hepatitis B, you most likely will have no symptoms until complications develop, which could be decades after you were infected. For this reason, hepatitis C screening is important even if you have no symptoms. The hepatitis C virus causes hepatitis C. The hepatitis C virus is spread through the contact with an infected person's blood. Contact can occur by sharing drug needles or other drug material, such as infected person getting an accidental stick with a needle which was used on an infected person, being tattooed or pierced with tools or inks that were not kept sterile, free from all viruses and all other microorganisms, and were used on an infected person before they were used on you, and having contact with the blood or open sores of an infected person, using an infected person's razors, toothbrushes, or nail clippers. Being born to a mother with hepatitis B, having unprotected sex with an infected person. You can get hepatitis B, you can't get hepatitis C from being coughed or sneezed or on by an infected person, drinking water or eating food, shaking hands or holding hands with an infected person, sharing spoons, fork, and other eating utensils, sitting next to an infected person. Babies cannot get hepatitis C from breast milk. Your doctors may order one or more blood tests to diagnose hepatitis C. A healthcare professional will take a blood sample from you and send the sample to a lab. Blood tests for hepatitis C include screening for antibodies to the hepatitis C virus. A screening blood test will show whether you have developed antibodies to the hepatitis C virus. A positive antibody test means that you were exposed to the hepatitis C virus at some point. However, the virus may no longer be present in your blood if your body fought off the infection on its own or if you received treatment that cured the infection. Hepatitis C RNA test. If your antibody test is positive, your doctor will use hepatitis C RNA test to detect RNA, a type of genetic material from the hepatitis C virus. The hepatitis C RNA test can show whether you will have the hepatitis C virus and how much virus is in your blood. This information can help your doctor treat the infection. To see if you are responding to treatment, your doctor may order the test while you are undergoing treatment to find out if the amount of virus in your blood is changing. Then another type is genotype test. Your doctor can use this test to find out what strain or form of hepatitis C virus you have. At least 6 specific strains called genotypes of hepatitis C exist. Genotypes 1 is the most common hepatitis C genotype in the United States. Your doctor will recommend treatment based on which hepatitis C genotype you have. If you have had chronic hepatitis C for a long time, you could have liver damage. Your doctor may recommend additional tests to find out whether you have a liver damage, how much liver damage you have, or to rule out other causes of liver disease. These tests may include blood tests, transient elastography, a special ultrasound of your liver biopsy in which a doctor uses a needle to take a small piece of tissue from your liver. Doctors typically use liver biopsy only if your other Tests do not provide enough information about a person's liver's damage or disease. Talk with your doctor about which tests are best for you. Doctors treat hepatitis C with antiviral medicines that attack the virus and can cure the disease in most cases. Several newer medicines called direct-acting antiviral medicines have been approved to treat hepatitis C since 2013. Study shows that these medicines can cure chronic hepatitis C in the most people with the disease. These medicines can also cure acute hepatitis C. In some cases, doctors recommend waiting to see if an acute infection becomes chronic before starting treatment. Your doctor may prescribe one or more of these newer direct-acting antiviral medicines to treat hepatitis C.
As far as treatment is concerned, HCV genotype 1A with no cirrhosis, we have to give 8 weeks of treatment including the medicine Glycaprevir and Pebrenestavir, or we have to give Ledipasvir or Sofosbuvir. The latter for the people who do not have HIV or AIDS, are not African Americans, and have less than 6 million HCV viral copies per milliliter of blood, or 12 weeks of Elbasvir and Grazoprevir, Ledipasvir and Sobosbuvir combination, or Sobosbuvir and Valpatasavir combination. So Sofosbuvir with either Dacaltasavir, or either we give Simiprevir, which can also be used. Then in HCV genotype 1A with compensated cirrhosis, 12 weeks of treatment is given of about Elbasvir and Grazoprevir, or either we give Glycaprevir and Pebrentasvir combination, and Ledipasvir and Sobosbuvir combination, or Sobosbuvir and Valpatasavir. An alternative treatment regimen of Elbasvir and Grazoprevir with weight-based ribavirin for 16 weeks can be used if the HCV is found to have antiviral resistance mutations against NS5A protease inhibitors. Then, in the case of HCV genotype 1B with no cirrhosis, we have to give for 8 weeks Glycaprevir and Pebrentasavir combination, or Ledipasvir and Sobosbuvir combination with the aforementioned limitations for the later as above, or 12 weeks of Elbasvir and Grazoprevir combination and Ledipasvir and Sobosbuvir combination, or Sobosbuvir and Valpatasavir combination. Alternative regimens include 12 weeks of Ombetsavir and Paritaprevir and Ritonavir combination with Dasabuvir, or 12 weeks of Sobosbuvir with either Dacaltasavir or Simiprevir. HCV genotype 1B with compensated cirrhosis, for 12 weeks of treatment we give Elbasvir with the combination of Grazoprevir and Glycaprevir combination with Pebrentasavir, and Ledipasavir with combination of Sobosbuvir or Sobosbuvir with the Valpatasavir. A 12-week course of Paritaprevir and Ritonavir and Ombetsavir with Dasabuvir may also be used. In HCV genotype 2 with no cirrhosis, 8 weeks of Glycaprevir, Pebrentasavir, or 12 weeks of Sobosbuvir with combination of Valpatasavir may be given. Alternatively, 12 weeks of Sabospovir with Dacaltasavir can be used. In HCV genotype 2 with compensated cirrhosis, 12 weeks of treatment of Sabospovir with Valpatsavir or Gliclapivir with a combination of Pibrentasavir can be given. An alternative regimen of Sabospovir with the Dacaltasavir can be used for 16 to 24 weeks. In HCV genotype 3 with no cirrhosis, 8 weeks of Gliclapivir with a combination of Pibrentasavir or 12 weeks of Sabospovir with Valpatsavir or Sabospovir and the combination of Dacaltasavir may be used. In HCV genotype 3 with compensated cirrhosis, 12 weeks of treatment of Gliclapivir with a combination of Pibrentasavir may be given, or Sabospovir with the combination of Valpatsavir, or if certain antiviral mutations are present, 12 weeks of Sabospovir with a combination of Valpatsavir and Voxilapivir might be given when certain antiviral mutations are present, or 24 weeks of Sabospovir and Dacaltasavir is being used. HCV genotype 4 with no cirrhosis, we have to give 8 weeks of treatment of Gliclapivir with the combination of Pibrentasavir, or 12 weeks of Sabospovir with a combination of Valpatsavir, and either Albasavir with a combination of Grazoprevir or Ledipasvir with a combination of Sabospovir we are giving. And a 12-week regimen of Ombetsavir with a combination of Paritapiprevir and Ritonavir is also acceptable in combination with weight-based ribavirin. In HCV genotype 4 with compensated cirrhosis, a 12-week regimen of Sabospovir with Valpatsavir is being given, either Gliclapivir or Pibrentasavir, and Albasavir and Grazoprevir or Ledipasvir with a combination of Sabospovir is recommended. A 12-week course of Ombetsavir, Paritaprevir and Ritonavir with the weight-based ribavirin is an acceptable alternative. In HCV genotype 5 or 6 with or without compensated cirrhosis, if no cirrhosis is present, then 8 weeks of Gliclapivir with a combination of Pibrentasavir is recommended. If cirrhosis is present, then a 12-week course of Gliclapivir with the combination of Pibrentasavir and Sabospovir with the combination of Valpatsavir or Ledipasavir with the combination of Sabospovir is warranted. More than 90% of people with chronic infection can be cured when treated with medications. However, assessing these treatments can be expensive. The combination of Sabospovir, Valpatsavir and Voxilapivir may be used in those who have previously been treated with Sabospovir or other drugs that inhibit NS5A and were not cured. Prior to 2011, treatment consisted of a combination of pegylated interferon alpha and ribavirin for a period of 24 or 48 weeks, depending on HCV genotype. This treatment produces cure rates of between 70 and 80% for genotype 2 and 3 respectively, and 45 to 70% for genotypes 1 and 4. Adverse effects with these treatments were common, with 50 to 60% of those being treated experiencing flu-like symptoms and nearly a third experiencing depression or other emotional issues. Treatment during the first 6 months of infection, the acute stage, is more effective than when hepatitis C has entered the chronic stage. In those with chronic hepatitis B, treatment for hepatitis C results in reactivation of hepatitis B about 25% of the time. Cirrhosis due to hepatitis C is a common reason for liver transplantation, though the virus usually 80 to 90% of cases recurs afterward. Infection of the graft leads to 10 to 30% of people developing cirrhosis within 5 years, and treatment with pegylated interferon and ribavirin post-transplant decreases the risk of recurrence to 70%. A 2013 review found no clear evidence as to whether antiviral medication is useful if the graft became reinfective. And alternative medicines, several alternative therapies are claimed by their proponents to be helpful for hepatitis C, including the milk thistle, ginseng, and colloidal silver. However, no alternative therapy has been shown to improve outcomes for hepatitis C patients, and no evidence exists that alternative therapies have any effect on the virus.
You need to take medicines for 8 to 24 weeks to cure hepatitis C. Your doctor will prescribe medicines and recommend a length of treatment based on which hepatitis C genotype you have, how much liver damage you have, whether you have been treated for hepatitis C in the past. Your doctor may order blood test during and after your treatment. Blood test can show whether the treatment is working. Hepatitis C medicines cure the infection in most people who complete treatment. Hepatitis C medicines may cause side effects. Talk with your doctor about the side effects of the treatment. Check with your doctor about taking any other prescription or over-the-counter medications. For safety reasons, talk with your doctor before using dietary supplements such as vitamins or any complementary alternative medicines or medical practices. What will be the cost of hepatitis C medicine? Newer direct-acting antiviral medicines for hepatitis C can be costly. Most government and private health insurance prescription drug plans provide some coverage for these medicines. Talk with your doctor about your health insurance coverage for hepatitis C medicines. Drug companies, non-profit organizations, and some states offer programs that can help pay for hepatitis C medicines. If you need help paying for medicines, talk with your doctor. Learn more about financial help for hepatitis C medicines. If hepatitis C leads to cirrhosis, you should see a doctor who specializes in liver disease. Doctors can treat the health problems related to cirrhosis with medicine, surgery, and other medical procedures. If you have cirrhosis, you have an increased chance of liver cancer. Your doctor may order an ultrasound test to check for liver cancer. If hepatitis C leads to liver failure or liver cancer, you may need a liver transplant. And in the last, if you don't have hepatitis C, you can help protect yourself from hepatitis C infection by not sharing drug needles or other drug materials, wearing gloves if you have to touch another person's blood or open sores, making sure your tattoo artist or body piercers uses sterile tools and unopened ink, and not sharing personal items such as toothbrushes, razors, or nail clippers. Hepatitis C can spread from person to person during sex, but the chances are low. People who have multiple sex partners, have HIV or other sexually transmitted diseases, or who engage in rough or anal sex have a chance of getting hepatitis C. Talk with your doctor about your risk of getting hepatitis C through sex and about safe sex practices, such as using a latex or polyurethane condom to help prevent the spread of hepatitis C. Researchers are still working on vaccines for hepatitis C. If you have hepatitis C, talk with your doctor about vaccines for hepatitis A and hepatitis B. These vaccines can protect you from hepatitis A and hepatitis B infections, which could further damage your liver. If you have hepatitis C, you should get a balanced, healthy diet. Talk with your doctor about healthy eating. You should also avoid alcohol because it can cause more liver damage.
If you have liked this video, then please subscribe my channel, and thank you for listening this video, and have a wonderful nice day.